It can feel so overwhelming, but what do you really need to get done before that baby comes? Today, we're going to go through a whole checklist of things about you. Now, this checklist may not be the same that you've seen in other places because a lot of places only concentrate on what needs to be done for baby. And yes, we're going to talk about baby, but we're also going to talk about you because I feel like you get forgotten in a lot of these scenarios. So I'm excited to give you some things to make sure that you're doing for you. And I know everything that you need to do before you come into the hospital because I worked labor and delivery for 20 years, and now I'm an online prenatal educator that gets you prepared to go to the hospital to have your baby. I'm so glad you're here. Give me a follow. Okay, if you're early on in pregnancy, make sure that you're talking with both HR and your insurance company to find out kind of how much you're going to have to pay for this baby, what your leave rights are, things like that. Again, this list is really going to concentrate more on you rather than just on baby, but I think a lot of people just sort of ignore this part until they end up getting the bill, or they don't know what their maternity leave looks like until they hit their third trimester. So talking with HR and your insurance benefits is going to be a big help as you head into delivery day. The next one you're going to want to do is pre-register at the hospital. Now, every hospital is a little bit different. I swear mine was still having you fax them in well into the 2020s. So just check with your hospital, see how you pre-register with them. The main benefit of this is you're not going to have to fill out as much paperwork when you get to the hospital in rip-roaring labor because that is not fun at all. So if you can give them your ID, if you can give them your insurance information, they can get that all in the system ahead of time so that when you show up at the hospital, it's not as overwhelming. Also, as you head into the third trimester, head back to HR to grab that disability paperwork that you're going to need. Usually your employer will have some on hand or they'll know where to point you to get it if you have state disability, but hopefully you get some maternity leave. I know that's not true for everybody. It was definitely not true for me on my first baby. Tell us down in the comments, are you getting maternity leave? How much is it? Everybody's different. I will say I got no maternity leave on my first, and then with my second, we lived in California, which has state disability, which was a huge deal for us. Either way, it's so important to know what kind of benefits you're going to have so that you can plan for what things are going to look like after the baby's born. Of course, also a good time to think, are you going back to this job after you have the baby? The good news is you don't have to tell anybody until right before you come back from leave. So even if you're just kind of like on the fence, you really don't have to decide until right before you're going back. And I know a lot of you are going to say, oh my gosh, who has to go back to work so early on? I got to say, going back to work, now I worked part-time, was actually really great for my postpartum anxiety. So while it was annoying and sad to leave my babies, it was also really good for me to go back to work and have some sense of stability, which I didn't feel like I had at home with a new baby. And if that makes me a bad mom, so be it. But the girl's 16, so I feel like I can say stuff like this now. Okay. Start making your prenatal appointments in advance. Those first ones you only need like every month, but I swear as you get later into pregnancy, I thought I saw my OB more than I saw my husband. It was a lot of appointments. So the further out in advance you can make them, the higher priority they can be in your schedule. You can make sure that you got work off. If you want to get daycare, those kinds of things, just make sure that you're getting those appointments and make sure that you're going to them. I hear so often people not prioritizing those prenatal appointments because they seem long and fairly pointless. And I totally get that. Measure my belly. Everything looks great. That is an awesome appointment. Be so glad that that's what your appointment looks like versus, hey, we're seeing some problems. It does feel useless a lot of the time, but you still got to go to make sure things are progressing okay. Pregnancy appointments are really where they are so that they can catch specific things at specific times. So even though, like I said, they seem pointless, they really are not. And if you're going to your appointment and it's taking forever, ask them if there's any way to make it faster. Can you see the physician's assistant? Can you see the nurse practitioner? Those types of people can definitely catch issues during pregnancy, similar to how your OB can. And a lot of times those appointments are faster because they're not going to the hospital to deliver babies. Okay, this one's a little bit controversial. I see a lot of people online saying, oh, my doctor will just prepare me or I don't need one, but take a birth class. I usually recommend that you pick out your birth class early in your second trimester. So before you hit about 27 weeks. And then when you hit that third trimester, you want to start taking the birth class. Now, some of you might be taking it in the hospital. I see a lot of times my hospital classes are full and it's too late for me to take the next round. The good news is there's a ton of online birth classes. I host the online prenatal class for couples. It is the the easy way to get prepared for your upcoming hospital birth. And I say that we get you prepared, not scared. So it's available 24/7 on demand. And the good news is there are a lot of on-demand birth classes available. I know that it is really easy to think that you don't need to prioritize a birth class, but the more and more birth trauma that I see coming out of the hospitals, I really think that if you prioritize getting a class that helps you make decisions while in labor, you're going to be miles ahead, and that birth trauma is not going to be in your rearview mirror. So get a birth class in. I'll put the link to mine down below, but I do think it's really important that you find a class with somebody that you jive with. So if you like this video, I bet you'd love to be in that class with me. I also have a few more freebies that you guys can check out to see if we're a good fit. Okay, as you head into 34-ish weeks, I recommend that you pack your hospital bag. Now, I'm not saying everything. I have a whole video on the essentials to put in your birth bag, and I think those are the things that you really have in a bag ready to go just in case. Let's say you go to an appointment, your provider's like, you need to go to the hospital right now. Your partner can drive by your house, grab that bag, and you'll have the things that you need in the hospital. I really am just talking about the basics, so check out that video so you can find out what you should really have just in a small bag ready to go just in case. I'm not saying you need to pack everything, just the basics. As a note, if you come into the hospital emergently, we have all the things that you'll need to take care of yourself. So that's the good news, unless you have contacts like your girl. I always have such a fear of having to go to the hospital and having contacts in and not being able to take them out. Yeah, as if there's not contact solution at CVS. I don't know. Okay, have you taken a hospital tour? Now, during COVID, a lot of these went online or just non-existent, but I hope hospitals are bringing back the in-person tour because I think it's so nice to actually be able to see with your eyeballs where you're going to be delivering your baby and be able to ask questions about how things work at the hospital. Now, I have a whole podcast episode on the importance of taking hospital tours, so check that out if you're interested in more about taking your hospital tour and the questions you should ask. But I think the main ones are, where should I be parking? What can we do about food in the hospital? Because some rooms have like a fridge, or sometimes they provide food for the dads or things like that. So finding out how food is provided at the hospital can be really nice to know. Will you go to a different room after you have your baby? Do they have a nursery for the baby in case you want to get some rest? These are good questions to ask while you're on your hospital tour. And I know a lot of people think, oh, I didn't get my birth class at the hospital. I missed the hospital tour, but that's not the case at all. They have hospital tours available for anyone to take because they're ultimately a marketing thing to get you to come to that hospital. I used to do them all the time. And I actually used to see people pretty early on in pregnancy who were kind of trying to decide who their provider should be based on which hospital they wanted to deliver at. So don't feel like, oh, I'm going in too early, because we really had people who were in their first trimester doing those hospital tours. And that's valid. You can always take a hospital tour again later in pregnancy in case you want more information. And if your hospital only offers a virtual tour, I would still do it because it's better than nothing. Okay, here's one that I see not talked about a lot, but I am a huge journaler. I think it is so helpful to get out those feelings and get those thoughts out, because later on you can look back and say, you know, I was really scared about this, but it turns out I got prepared in a birth class and things went okay. I think it's so great to journal about all the things you're hoping for with this baby and for this pregnancy and for you as a family. I just think it's something that you're really going to look back on and enjoy the memories of being pregnant. Now, no matter how you do it, if it's a handwritten journal or just writing a few thoughts in your notepad, I think you're really going to enjoy looking back and reading those. Okay, have you considered a birth plan? Now, I do not think that this is a requirement. Obviously, your baby will come out without a birth plan. However, it's really nice to think about your options in the labor room. I actually have a whole freebie series called Birth Plans Made Easy, and you guys can jump in there and find out how I recommend making a birth plan. It also comes with a great printable birth plan that gives you a lot of the things that the hospital will just want to know about you. As a labor and delivery nurse, it's really tricky to just meet somebody and immediately kind of know how they want their birth to go. So when you give them a birth plan, it's just a really quick way for them to get to know you, what you're hoping for your birth. Is it a plan that your birth is going to follow? Absolutely not. But it's a great way to start thinking about making choices and also letting the staff get to know you and what your birth hopes are. I totally recommend it. Grab my freebie down below. Now, here's a few things to do right before you go to the hospital. Number one is to eat. Unless you're having a C-section or they've specifically said do not eat before you come into the hospital, because it is important that you not eat before you go for a scheduled C-section because they will stop it. But if you're just going in for regular labor, so many people don't eat, and it's a mistake because we often can't feed you in the hospital, or even if we can feed you, our food is just not it's not top notch. So make sure that you're getting some food in you before you go into the hospital. I'm not saying to eat the double-sized burrito. What I am saying is get a meal that you enjoy, makes you happy, and you feel full but not over full before you go in to have your baby, because there is a chance that you could see that food again when you start contracting. Sometimes your stomach is like, I want to get in on the action too. It's not usually something that happens, and we have medications we can give you if you start to feel nauseated or start to vomit. This video is getting so fun. Be sure and follow me. Oh, it's okay. Okay, make sure that you've got your postpartum supplies together. Again, everyone talks about what the baby's going to need, but do people talk about what you are going to need when you come home? When you have your baby, there is going to be a placenta-sized scab on your uterus, and this is what bleeds. I know a lot of people think they're bleeding from tearing in the birth canal, but that is usually the minimal amount of bleeding. It's mostly from this big scar the placenta left after the baby was delivered. So you're going to need big pads. Think Depends. I think they're so helpful. I know a lot of you are like, what? That's what my grandma wears. But it's so nice to have a lot of real estate to bleed on so you don't get it on your sheets when you get home, because I am the girl who does not love to do laundry. So I recommend a pack of Depends and then a pack or two of nighttime pads, because you are going to be bleeding a lot, and then it slowly tapers. Other things you want to consider are tucks. Some people like to make padsicles, although I've also had other people say that they felt like they were really messy when they started to melt. There are companies that make things that can be cold inside your underwear, like ice packs that can be reused, washed, and reused. And I think those would be really helpful. I think cold down there is something that can really help. So just thinking through a few of those things in advance. The hospital should give you tucks. They should give you a squirt bottle. My biggest pro tip is to install a bidet. If I had had a bidet after I had my baby, I think I would have been so happy. I loved the squeeze bottle. I would sit there and just refill it to get that cold right on my perineum, but a bidet would have been real nice. And they're not that expensive at Home Depot, and they're not that difficult to install. And even if you rent, they're pretty easy to pull out as well. Now, of course, you also want to be prepared for baby. I'm not going to go into this because this video is getting long enough already. If you're interested in a video on the necessities that you need for a new baby, go ahead and comment below and I'll try and make one of those coming up. You know, something I didn't mention was going in for the bikini wax, right? A lot of people are worried that they need to take care of themselves down there before they go in to have the baby. And I'm here to tell you that we really don't care. Just do something that makes you feel comfortable and doesn't make your skin react in a negative way, and we're good to go. One of the things I hear far too often on social media is people making choices way ahead of time before they get to the labor and delivery room. Example, I am not going to have any cervical exams while I'm in labor. There are things that you really can only make choices for once you are in labor and delivery. I have a whole video about it. I'm going to put it up here so that you guys can check it out. I think you'll really enjoy it and find it very, very helpful. Okay, how are you preparing for your baby? Tell us down in the comments. Give this video a like, share it with your friends. I really appreciate it. We're really trying to grow our channel, and when you guys do stuff like that, it really helps us grow. And be sure and check out that video. I think it's going to be really helpful.